sorry. I didn't mean to whisper as deep as I have been. I've just been getting over a cold, and I like to have a kind of low tone with my patients. I feel that it creates a better connection between you and I. But anyway, my name is Dr. Karuna Satori. You may call me Sarah. We're not very politically correct, if that's the word here. We just like to establish a personal connection again. We want everybody here to feel comfortable, and that's what I strive to do for you today. So, you are here for a cranial nerve examination. I'm going to be doing the full facial examination with the sight test, smell test, hearing test, touch response, and things of that nature. I'm also going to be doing an examination of the face, the mouth, the jaw, the cheeks, the nose, looking in your nose. So basically I'm going to be testing the nerves that supply your face. That is what a cranial nerve examination is. So, have you been having any pain lately? Any change in your facial structure, for example? Maybe one side of your face has been drooping. That is a sign of a stroke, and we should probably check that out. So, any changes in just daily life? No problem. Yeah, absolutely. Good. All right. So I'm just going to verify some of your information, and then we will get started. So, is your name still correct on the chart? Can you say your full name for me? That's a beautiful name. Can I have your birthday verified? Yep. Okay. Are you taking Are you taking any medications lately? Anything changed? Anything different? Okay. Now, how much is that a day if taken every day, or just randomly? What? Okay, that wasn't on the chart, but no worries. We'll have that updated. And you said you reported no pain, mild pain, little pain. Okay, great. So, that is about it. I don't know why the lead won't go back in this pencil. Okay. So, we've verified your information. The first thing I'm going to do is just ask for your permission to get a little bit close to you. I'm just going to do an overall examination, just checking for obvious signs of, symmetry, of any drooping, I'm going to have you speak very close to me, see if you have good speech. You may notice that I have a little bit of a lisp. That's because I had some work done in my mouth. So, okay, so do you mind that I get close to you? Do you mind that I do some mild touching today? Actually, some firm touching when I get under the jaw, but nothing uncomfortable. Many say that cranial nerve examinations are actually very relaxing. So, thank you. All right, great. I want you to feel comfortable, not that I'm being forceful or anything. And don't mind the extremely horrible color of my nails. Horrible. Just please. Okay. So what I'm doing, I'm just going around on the forehead here. Just basically gentle pressing around the face. under the jaw. I'm looking for what's called signs around the bed, which are, see if you have hearing aids, or obviously if you're wearing glasses or not. Signs around the bed has also recently included dentures. I just touched my teeth. Hold on, let me get some hand sanitizer. Forgive me. So anyway, moving on. Dentures, and recently with different trends and things like that, eyelash extensions, Botox fillers, things like that. And that is because when a person gets Botox in the face or eyelash extensions, it can obstruct the movement of your eyes or the ability to move your face. So, for example, lip injections, if you've ever had them before, they can definitely cause issues in regards to speaking, especially if you just got them done. They swell up like a balloon. Now, if it's on the forehead or anywhere on the face when you're smiling, it constricts, blood vessels. Your face is very, very tight, so that can definitely affect you in the future. So just something to be aware of if you choose. I'm not judging you if you choose to do it. So, moving on. Alright, so the first test we are going to be doing on your face definitely seems in very good condition. You seem to have a very adequately symmetrical face. Nobody really has a perfectly symmetrical face, so definitely don't worry, you're in the excellent area. I'm going to be doing your eyes. I'm going to be checking your eyes in a number of ways. I'm going to be checking the movement of your eyes with light. I'm going to be checking your pupil dilation and constriction. I'm going to be checking your sight. As you can tell, my professional chart right here. And we're also going to be doing a color test to make sure that you can see certain colors, okay? So the first thing I'm going to do is I'm just going to see how your pupils are. You know what? We'll do this test first, because if I'm shining light in your eye, it could cause, different little balls of light in your eye after, obviously, if you're in the sun and things like that. So let me grab my light. Usually, doctors use a flashlight, torchlight, and just go back and forth, but I've found that red lighting actually causes the eye to pay attention more, to work harder, and that's what we want. We want to see how the eye works when put under certain pressure, things like that, but nothing dangerous. So, okay. So I'm going to start by turning this on. And I'm just going to do some back and forth testing, getting up close, things like that, okay? Ready? All right. So what I'm going to have you do is just follow the light. Okay. Good. Okay. Excuse me a minute. Thank you. Just gonna get a little bit closer now. Just look directly in the light. I know it's very close and in the middle. We want to see how your eyes get. Okay. Okay, I'm going to come in like this. I'm going to come in like this. Like this. Like that. No. Okay. Like this. Okay, great. So what I'm going to do next is I'm actually going to get a latex glove. I am going to be checking the rims, if you will, of your eyes. Excuse me. I inhaled some of my own spit earlier because of the mouth work I had done. So, alright, so what I'm going to do is first I'm just going to check your eyes, your eye area. Pull down your eye, look up with your eye, then I'm going to put the light very, very up close in your eye. It's going to show me the blood vessels, it's going to highlight them, you know, red and red, things like that. So far so good with your movement. I noticed that you followed the light pretty easy. I understand we're in a very bright room. I may turn the light off and try this again. So let's just get an examination of the eyes, okay? So I'm just lifting up the right eyelid. Okay, if I can get a little close to you, if that's alright. Thank you. Okay. Well, there goes my test, but we'll fix that. Let me get your left eye here. Okay. Just looking at the bottom here. The left eye, or the right eye, forgive me. Right eye, or left eye. I'm getting all my words mixed up right now. It appears I have something on my nose. I can feel it. Forgive me. It's dry skin. Even doctors get self-conscious. I don't want to offend a patient or something like that. But right now, I am going to turn on the light and get close. Just lift up, lift down, lift up, pull down. You get it. So up. I know that's a little bit up close. No problem. Okay. Pull down. Yep. Okay. Other side. Lift up. Pull down. Brilliant. Okay, so I am done. Well, you know what? After this, excuse me, we'll do the taste test. I'm going to turn the light off, and we're going to try that vision test one more time, just to be absolutely sure, okay? Alright, so it's going to get very dark in a moment. Are you ready? Brilliant. Okay, so let's see. Just follow the light, even if it's far away. Brilliant. Thank you. I'm going to turn the light on now. If you would like, you can close your eyes, and that will definitely help with the adjustment when the light turns on behind the eyelids, obviously. Okay? Ready? 1, 2, 3. On. Okay. You did brilliant. So, while I still have my glove on, I'm just going to do an overall mouth check, okay? So how that's going to work, I'm just going to have you open your mouth. I'm just going to stick my finger, if that is okay, just on the cheek and pull very quickly. Other side, pull. I'm going to pull down on your jaw. I'm going to have you try to stop my finger from pulling down your jaw. So essentially you're going to be going like that. Is that okay? And then I'm going to put 2 fingers in your mouth and push up, and I'm going to have you try to push my hand down. Do you mind that? Is that too invasive? If it is, I completely understand. We have patients like that, and there's no problem. It's just to be certain. Thank you. Okay, so first I'm just going to press on your lips, around your lips and things like that. So And you don't have any fillers or anything like that? Okay, you have very nice lips. I don't know if that is something you compliment a person about, but it's something I noticed and I think it was nice, so. Okay. Okay. Alright, so go ahead and open your mouth. I'm just gonna hook and pull and hook and pull. Ready? Very gentle. Open your mouth, go on the right, hook and pull. Okay? Left, hook and pull. Great. Alright, so I'm going to take 2 fingers and I'm going to have you open your mouth wide like ah. And I'm going to push down on your front teeth, your tongue and everything like that. And what I'm going to have you do is just go, like lift your head up and try to stop my hand, okay? Then we'll do it on the top. Alright, ready? Okay, ready? Go ahead. Stop my hand. Perfect. Go ahead and open your mouth. We'll do the top. Stop my hand. Brilliant. You did great. So that is pretty much the inspection. When I push down on your 2 front teeth, I also push down on your tongue, and you have a good reflex in that respect. So let me throw this away. Get a little hand sanitizer to make sure. Alright, brilliant. Alright, so the next test we're going to do is a taste test. Since I did the reflexes around the mouth, we're just going to continue on with the taste test. So, usually during cranial nerve examinations, there will be at least 3 or more tastes, different flavors of certain things, but I have 2. I truly believe that there are only 2 types of triggering responses in the mouth when eating. Even smelling you can taste. It's essentially you're tasting something when you're smelling it in a way. So what I'm going to be doing is dripping a drop or 2 of each of these 2 liquids on your tongue, and I need you to tell me to the best of your ability what you believe that these tastes are, okay? And yes, they can even resemble a smell. For example, if I put a taste of a cloud or you can't smell cloud, but the taste of grass. You know the smell of grass, and whenever you taste it, you're like, that tastes like grass. So, let me get these out. Sorry, I had something on the chart fall here. Everything's falling apart. You know what? I don't even need this. And then, after the taste test, we'll go back to the vision test as I use the gloves after the light to do your mouth. So we're kind of a little bit off what we're trying to go for here, but that's okay. So got one. Put that here very quickly. And the other. So, don't worry, the liquids are very harmless. They're literally just a couple different sugars and flavors, mostly natural. Just need a drop. A dab will do ya. Alright, so you ready? Just open your mouth, stick out your tongue, go ah. Okay. Go. I ate his liver with some fava beans and a nice Chianti. Sorry. Silence of the Lambs. No humor right now, okay. So let that just taste it. Be like one of those wine testers who think they understand what they're doing. All right. What do you think it is? That is right. It is citrus. That can go with anything. Oranges, melons, things like that. You did great. Thank you. I'm happy for that. Now let's get number 2. Forgive the noise. I'm waiting on a phone call from my mother, actually. A very important phone call. So, now this one right here, you may have a little bit of trouble distinguishing what this may be, but that's completely okay. We as humans actually confuse this taste with another taste, and I'll explain depending on if you can get it right. Ready? Open up your mouth. Say ah. Okay. So, go. Tell me what you think. Go ahead. Oh my goodness, we have rats or something crawling up the rafters, but anyway. Okay, yes, it is sour, but what do you taste? Is there a flavor to it? Does it resemble anything else? Okay, so what the taste is, you're absolutely right. You definitely passed that test verbatim. It is a sweet and sour, and again, it's namely sour, so you got the answer right, but it's also mixed with a little bit of sugars, and it's supposed to create the illusion that you are tasting something sweet and sour, like a Sour Patch Kid. First it's sour, then it's sweet, you know, all that good stuff. But you did excellent. So far you are passing this with flying colors, and there's no right or wrong. I want to let you know that. You don't have to feel as if you have to do something a certain way, because it's better to actually find something wrong and be thorough about it and be able to fix it than just fly through the test and not pay attention. So let's go back to our vision. I'm going to get my extremely failed paper test held up by some cat tape. What I'm going to have you do, so I'm just going to have you tell me which line you can read the easiest. Okay. That is an F, but that's okay. It kind of looks like a P. Good. Okay. Can you tell me, obviously, the biggest line you can read? Yeah. Okay. What I'm going to do is I'm going to cover your left eye, and I'm going to have you tell me the lowest line you can read, okay? Okay, ready? Go ahead. Good, okay. And your right eye. Go ahead, give it a try. Good. Well, you did absolutely well on this. Let's see, pretty much have 20 out of 20 vision. So, alright. Next, we're going to do the color test, and then I'm going to do the follow my finger test, okay? Kind of like how we did the light in the beginning. It's just more along the lines of following something that's not going to constrict your pupils or make them, you know, bigger. So, alright. Can you tell me what this is? Excellent. An 8. Okay. A 9. Absolutely. Very good. A 7. Great. Okay, so no color blindness there. You got everyone correct. Awesome. All right, so next, I'm just going to be using my fingers. And what I'm going to need you to do is just do what you did with the light test, if you would, please. Follow my fingers gently, okay? Follow them slowly. Nothing you're doing wrong, nothing you're doing right. Well, you're doing it right. Go ahead, keep it up. Okay. And back. Keep following. You're doing excellent, I promise. Promise. Just go ahead. Make it a little faster, no problem. Okay, so your vision looks good as far as that I can see. Get it? I very much think that you passed that test very well. So the next thing we're going to do is the hearing test, and then we'll do the smell test, and you should be very well off. And then we'll document everything that transpired during this exam, and you'll be good. So with your hearing test, we're going to do a little bit of ear cupping, okay? So I'm just going to get a little close. I'm going to cup your right ear and then your left ear. Do some snapping mouth sounds. Tell me what you hear, okay? All right, so first, if you don't mind, I'd like to examine the ear. Is that okay? Okay, just get a little close and pinch the ear. Pinch. Other ear. All right, good. I'm just gonna have a look in the ear here. Let me grab my light. All right, let's look in the ear. Okay. Other side. Okay. Brilliant. Your ears look very well, so we're ready to start the test. Alright, so I'm just going to get over here in your right ear. Alright, let's do some cupping here. Oh. Okay. Good. Oh. Okay, excellent. Now we'll do both ears. Ready? Alright, so I'm just going to cover one ear and do some noise. Tell me which ear you hear this out of. Very good, that was both. Alright, ready? Which side do you hear that coming from? Very good, both. Cover your right ear. What do you hear? Okay, nom nom nom. Other side. Okay, shoe or show. Very, very good. So that concludes the ear test. You did very well. Outside of the ears look good. Inside of the ears, you have a little bit of wax going on, but it's healthy. That's definitely something you don't want to be taking a Q-tip like the show girls and just shoving it as far as you can into your ear and then having to go to the emergency room. So it's always good to just kind of let wax build up. If it ever gets too much, then we can take care of it. So. All right, moving on. We are going to do our smell test now. I'm just going to take the light once more. Lift up your nose, feel around the cartilage, make sure everything's in place, okay? Okay, so we would show if you had a deviated septum by what I'm going to do. So I'm just going to pinch your nose. Ready? From up to down, down to up, up to down. Very, very good. All right, so I'm just going to lift up the butt of the nose and look in, okay? I also have something I'm going to do. Okay. Everything looks well. Healthy colored snot, if you will. So, with that, actually, we'll wait until afterwards because I have to do a facial examination. So what I have here, 2 little cases. I'm going to open them and I'm going to put it under your nose and you tell me what you smell, okay? Just kind of like the taste test. No worries, it's not chloroform. If you fall asleep, it'll most likely be from hopefully the relaxation of this test. Hopefully. Go ahead and tell me what you smell. I was going to say like because I enjoy this smell. Yes, that is pure vanilla extract. Very, very good. Okay, and the next one. No, I'm not selling this. This is mine. No, I'm kidding. I'm kidding. Tell me what you smell here. Yes, well, not basil, but oregano. So you are definitely close. I remember those days. We were always sold when I was just a young girl. Lots of oregano in plastic baggies, and for some reason we thought it was real. So, anyway, to finish off the test, I am just going to gently have you close your eyes, and I'm going to go over your face with some just feelings. Make sure you can feel everything. I'm going to touch you in certain places on the face if you don't mind, and I just need you to respond with either yes, I can feel that, or no, I can't, okay? And tell me if it's a hard touch or a soft touch. You ready? All right, go ahead and close your eyes. Okay, very good. Yes, soft. Soft. Okay, hard. Soft, very good. 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 Very, very good. You're doing great, sweetie. You're doing amazing, sweetie. Got a little snot on there. All right, you did great. Your nose is running a little bit. Sorry, I had to get that up. So, that pretty much concludes the test. The last thing I wanted to wait for is I wanted to see your reflex in regards to sneezing. You seem to have a little bit of a cold going on, and I just wanted to see if it was an internal or external cold. For example, if you had maybe like a flesh-eating bacteria. I'm kidding. Some of my family just actually had that and survived. But anyway, just to see if maybe it's, swelling of the lymph nodes. You can tell a little bit if you don't mind. Just feeling under your jaw there. Yeah, you've got a little bit of swelling of the lymph nodes, just to see if you have any, that this cotton ball has yellow snot on it, which is a sign of infection. Now that could just be from simple allergies or anything else. So I'm just going to gently stick this up your nose, and it's immediately going to trigger a response, okay? If you have an allergy or an infection, all right? Is that okay? It'll tickle for a moment. Okay, ready? We're gonna try the right nostril where the most phlegm was. Get ready, 1, 2, 3. Okay. Excuse you, bless you. God bless you. Sorry. Yes, that is definitely 100% an allergy. No worries. It will definitely clear up on its own. I am not in a specialization in my field to diagnose you with anything, but in my opinion, not medical advice, nothing like that, but I think that you have an allergy going on. Now, if you go home and you start noticing you're feeling like a cough, obviously in the chest, or pain or pressure or anything like that, please go to the emergency room and don't tell them that I told you that you had an allergy. All right, so what I'm going to do, finally, I am going to just document some of the things that transpired today, and then we'll overall diagnose you with whatever we have to that I'm in this special field to do. Okay, so in regards to your vision, give that a 10 out of 10. Then we have your hearing, okay, smell, a 9 out of 10. Okay. All right, so overall, let's add those numbers up. All right, so you scored a 98 out of 100. I scored you 9 out of 10 with your smell because you have an infection and allergy, and I also scored you a 9 out of 10 in your hearing, so that was probably my fault. So overall, you've gotten a perfect on the test, so. All right, and you got a 10 out of 10 for friendliness, so thank you so very, very much for coming today and meeting me. If you would like to schedule, the nurse is out front, and I very much hope to see you again, okay? Thank you so much. Have a good day. You're nice and clean for health.